Welcome back, everybody. I hope you've had a great break and you're ready to step back into this last session of this first day. It has been packed with so much great things, and I got to tell you, I think we've saved some of the best for last. So be ready for this. I want to make just one quick note. The Ask the Expert groups, there's 5 of them that you'll find on this platform, and phenomenal opportunities for you to jump in and have some conversation with the people who really are just experts in their area, and they're waiting to sort of connect with you, particularly group 2. There's a discussion around patient-centered clinical practice and research. So please take a look at all of these. Use this. I often say this, whenever we get to, if we were in the same room together, we would be having so many of these insightful conversations because we'd have that opportunity. But to the best of your capacity, use these opportunities because they're waiting there to have these great discussions with you. So we're almost wrapped up in this day, but I got to tell you, this next panel is just filled with such phenomenal insight. The title of this last session for today is called "It Takes a Village," and I know you heard Manon talking a little bit about the nature of, we often say this about the work that we do, but I got to tell you, it's never been more true than it is right now in this time of disconnect. And so what these fine souls are going to be talking about is stakeholder engagement as a critical lens for the national strategy development and implementation. And again, our sponsor for this segment is the Family Institute of BC, as well as the Azzarelli Foundation. Thank you so much for sponsoring this session. This session features awardees for the KBHN CASDA Policy Development Practicum. The KBHN CASDA Policy Development Practicum Award aims to encourage trainees from all disciplines and training programs to explore the policy dimensions of their work in the field of autism. In this session, a KBHN CASDA Policy Fellow will present findings on their policy analysis, stakeholder mapping, and consultation to inform the next steps for implementation of the National Autism Strategy. In addition, key findings and lessons learned on the policy development and stakeholder mapping and consultation process will be shared. I'm telling you, they got, as we were preparing to get everybody on the screen at the same time and how we're going to navigate it, I just cannot wait for you to meet these incredible souls. The moderators are the phenomenal Dr. Jennifer Zwicker, brand new baby at home, and she's so excited to join us today. She's the KBHN Deputy Chief Scientific Officer and Director of Health Policy at the School of Public Policy at the University of Calgary. Joining her as a co-moderator is Jonathan Lai, who is the Executive Director of the Canadian Autism Spectrum Disorder Alliance. So please step into this beautiful presentation. They've got some time, and so they're really open to all of your questions and engagement. Right over to you, Jennifer and Jonathan. I can't wait to hear.
Wonderful. Thanks so much, Jody. We're really excited to be here and to showcase a lot of the great work that's been going on for these policy fellows. So just a little bit of background. The federal government's taking practical and actionable steps to develop a national autism strategy. You may have heard about it. And the Canadian Autism Spectrum Disorder Alliance, CASDA, and Kids Brain Health Network have partnered for the second year to hold these policy fellowships. So this partnership started in 2020, where we started on kind of developing some training opportunities for trainees to engage in this national autism strategy development and understand kind of the world of working in policy. So you can check out the policy compendium that was developed last year online on the Kids Brain Health Network and CASDA websites. And this year we've done this partnership again. And have been are pleased to discuss some of the ongoing work that the policy fellows have been engaging in. So we've been working, and the National Autism Strategy is right now being led by the Canadian Academy of Health Sciences, who is working with the Public Health Agency of Canada to really conduct an assessment to inform and develop this National Autism Strategy, which has 3 focuses. The first is social inclusion. The second is economic inclusion, and the third is evidence-based interventions. And so you're going to hear a little bit about each of those areas that the fellows have been working in. And we have these fellowships are offered to graduate students, postdocs, research associates, with the idea of gaining invaluable experience to work with community partners and understand a bit more about the policy development process. You're going to hear a bit about the content they're working on and about their experience. The idea is to really help understand linkages between research and policy, to help with working closely, which is helped by working closely with the amazing CASDA board members that are a big part of this whole process, and you're going to meet some of them today. So thanks to them for being a part of this. So first of all, big congratulations to this year's policy fellows and all the work that they've been immersed in, and I know they're really excited to be bringing that to you today. And I'm going to pass it over to John, who's going to give a little bit of background on the process that was used to date and lead us into the first session.
Thanks, Jen. As Jen mentioned, this year we've gone with a similar process to last year in selecting these policy fellows and forming these stakeholder working groups on these specific areas around social inclusion, evidence-based intervention, and economic inclusion. And these three themes and subject areas are areas that the government has put together. We actually brought in the evidence-based intervention to think about evidence-informed supports, realizing that there's a lot more out there than something that's specifically evidence-based, and perhaps our fellows will talk about that. So as I mentioned, similar to last year, we had a call for community members to join in each of these areas, each of these three areas in the spring, and they continued to work through the summer and into the fall. And the idea was to identify key issues, key problems, real world problems that are out there for families, for service providers, for clinicians, for researchers around these three areas. And then from that, to identify what the policy levers, the policy concerns, but policy gaps are, the promising practices that are out there, identifying who are the relevant stakeholders on the mapping, the implementation, and the monitoring of a national autism strategy as it's being built. And keeping in mind that the policymaking process, even though we're aiming for it to be specific it's intended to feed into the processes around the National Autism Strategy, we know that the work in policy applies to broader disability work. It's overlapping, and none of this is mutually exclusive as the government sees policy for neurodevelopmental disabilities. So last year, as Jen mentioned, we have a policy compendium up on our website, and that was welcomed. We submitted it to FAC, the Public Health Agency of Canada, and they thought it was a very useful piece of material. So this year, we're hoping for the same, as these policy fellows are in the process of finalizing their recommendations and their stakeholder mapping this year. We're hoping it will complement the work, the report done on the science of autism by the Canadian Academy of Health Sciences. That's going to be published in winter of next year. So just in a couple of months. So the idea of having this work is to have that support and build around a lot of the work done by the Canadian Academy. So without further ado, we'll dive into each of these three areas. We'll start off with social inclusion. We'll look at evidence-informed supports, and then we'll look at economic inclusion. The policy fellows will give a brief presentation of what they've done so far, some of the content of their work, just a snapshot of it, and they're happy to share more during the Q&A. And then we'll have the CASDA board members that were co-chairing some of these this work join some of the groups and answer some questions. So with that, we'll go over to social inclusion and over to Hadass. Actually, let me introduce her first, as she's brought into the screen. So Hadass Dahari is a doctoral candidate in the School of Applied Child Psychology at McGill University. Her interest is in autism research. It began while she was doing her BA in specialized honors psychology at York University, where she had opportunities to collaborate on various research projects that examine training memory strategy use and social emotional learning interventions for children on the spectrum. As a KBHN trainee, Hadass is enthusiastic about improving her understanding of how researchers, policymakers, people on the autism spectrum, and service providers can collaborate better to cater to the needs of the autism community. Over to you, Hadass.
Thank you so much. So thank you for having me on as the first session. I have to say I have the lovely partner of Jackie Guy, who can be here today, and our co-chairs Jill and Maddie. We're working together to do the social inclusion working group. So we were tasked, our first task was quite challenging because we had to decide what would be social inclusion for us. How would we define that? If you Google social inclusion, you're going to get so many different definitions. And so I think we're still working on a definition, but I think together we've come to an understanding that social inclusion really is about being accepted, being valued by society, and having equal opportunities to community resources so that children with and without disabilities across Canada can thrive and flourish in their environments. And so in order to get a better understanding of social inclusion experiences in Canada, we've held a number of consultations with stakeholders, so including autistic advocates, children, parents of children who have autism and other neurodevelopmental disabilities like fetal alcoholic spectrum disorder, service providers, experts in policymaking. And so we oriented these sessions on getting a better understanding of the barriers that are limiting autistic individuals and other neurodivergent individuals from fully and meaningfully participating in their environments. And also then reframing these barriers in terms of what can we do about them? How can we target these? And most challenging, how can we target them from a federal perspective, since we are informing a National Autism Strategy, which is a federal initiative. So at this point in time, we have about 2 briefs that are in advanced stages of preparation, one that is still in construction. And the very first one is focused on how we can create a cohesive framework to increase social inclusion in Canada. So as it stands right now, we do have accessibility standards, and the existing accessibility standards are mandate federally funded agencies to follow. However, there's a limitation in that they don't cover private sectors or provincially and territorial funded agencies. And so there's a little bit of a gap there. And what happens is that individuals within provinces and also across provinces have different experiences of social inclusion. So how do we sort of streamline social inclusion is our priority with our first brief. So we have started thinking about recommendations from a federal perspective. The first being, how can we extend federal accessibility standards to the private sector, to provincially and territorially funded organizations? And I think in order to do that, we're going to need lots of partnerships. We can't do this alone. So having cross-government, federal, provincial, and territorial governments working together to get a better understanding of accessibility standards across the country. And not to mention, we're going to need to monitor our progress across provinces, within provinces. So getting the data out there, I think the Canadian government typically does a really good job at getting the data that we need, but also we need to go a step further and disseminate that information promptly because decisions are being made on this data. The next brief is focusing on how can we increase physical space, accessibility to physical spaces and communication. So here we're really targeting individuals across the spectrum, individuals with other neurodevelopmental disabilities who have varying levels of cognitive and language skills, and how can we better cater to their needs. And so I think the Canadian government has started to take positive steps with the Accessible Canada Act, and I think we can do more. So right now, a lot of the heat has been on increasing accessibility for individuals with visible and physical disabilities. And although autistic and neurodivergent individuals experience very similar barriers, they also experience very different barriers from what we've gathered from our stakeholder meetings. And so we want to make sure their voices are heard in the National Autism Strategy. So for instance, making sensory adaptations to physical spaces, changing, using less complex language, visuals on signages to increase accessibility in terms of understanding when we are all in physical spaces, and also online as well. And then the last brief, and this one is the one that's under construction, is really focused on how can we promote awareness about autism and neurodivergence and to counter or reduce negative attitudes around this population. And so here we are looking at anywhere from supporting autistic individuals who are carrying out post-secondary level education, but also increasing potentially funding in the area of autism and neurodivergence to get increase awareness and also bridge the gap between clinical research and policy fields. And so I think the goal here across all three briefs is to increase social inclusion experience across the country so that Canadians with and without disabilities can participate fully and meaningfully in Canada. And I think I'll take it back to discussion.
Thanks, Hadas. And as the rest of the panel joins, I just want to say, social inclusion is such a big topic. And, in the end, we are looking for the same thing, right? Meaningful participation and inclusion within our society and what that looks like for the populations and people we care about. So joining on screen right now are two CASDA board members. First, Maddie Dever. He is an autistic adult and a parent of 5 children. 4 are also on the autism spectrum, living in rural Eastern Ontario. Maddie advocates both with the provincial and federal governments for the inclusion and acceptance of autistic people and for autistic people to have their own voice in policy decisions. They are also a former member of the OAP, the Ontario Autism Program Advisory Panel, and a current member of the implementation working group of the same, and also a member of the ECHO Autism Ontario Expert Hub team. They are an inaugural editor of the Canadian Journal of Autism Equity, and Maddie is a member of the CASDA's board of directors. Now, the other person joining right now is Jill Farber. Jill was appointed Executive Director of Autism Speaks Canada in 2013, following her active involvement as a member of the board of directors. With over 25 years of experience working with the autism community, her dedication has made a profound impact. Under her leadership, Autism Speaks Canada funding of innovative research and commitment to diverse programming has grown. Her attention to diversifying revenue has been pivotal to the success of Autism Speaks Canada. Participating collaboratively with stakeholders, community partners, and major corporate partners has resulted in the spread of an educational message around neurodiversity, acceptance, and inclusion across the country. And relevant to today's policy work, Jill was part of both the Canadian Autism Partnership Project Working Group and the National Autism Surveillance System Advisory Group chaired by the Public Health Agency of Canada. She maintains strong bonds with families with whom she works as a therapist early on in her career and is grateful for all that they have taught her. Jill's also a member of CASDA's board of directors. So some questions, maybe we'll start with Hadas to get us rolling. In terms of this fellowship, this internship, what made you decide to apply to this internship?
Yeah, great question. I think as I was going, so I am a PhD candidate in child psychology, and as I was getting more advancing in my academic journey, I developed a value that I wanted to live by as both a clinician in training and a researcher in training, and that was to increase accessibility to autistic individuals that I'm working with and also individuals with other neurodevelopmental disabilities. And I felt that the only way that I could do this, and the only way I wanted to do this, was to interact directly with individuals who have neurodevelopmental disabilities. And I felt like this was the perfect opportunity to do that, to learn directly from their lived experiences, and to better understand how I can service their needs and cater a variety of services, whether that's in the research domain or in the clinical domain.
Yeah, thanks, Hadas. And over to the CASDA board members. Maybe we'll start with Maddie. In terms of going through this process with Hadas and with Jill and the rest of the working group, what has worked well and what did you learn from the experience yourself?
Well, we had a wide spectrum of people with lived experience and professional experience that shared their different experiences, their different perspectives. We had many lively discussions on the needs of autistics in different periods of their life across different regions. But what we found is many of the needs are very similar and consistent. We use a lot of technology like Google Jamboards to share ideas, which is really helpful. And we also found that even though our focus was on social inclusion, there were intersections along many of the needs and solutions that we're looking at that intersected with the other two themes. And it was good to have the fellows talking amongst themselves and sharing what they're doing, so that it would inform us as we're keeping to the scope of what we're looking at doing with social inclusion. And as an autistic adult, I have a particular perspective and set of experiences. But it's great to hear from those who've had different experiences and able to learn the new challenges and solutions in the social inclusion area.
Yeah, thanks, Maddie. And maybe I'll go to Hadass and then back to you, Jill. But coming from a researcher perspective, what strengths did you find, with your training and background that you brought to this kind of work, and maybe some of the challenges? What might have surprised you in this kind of work?
So I think in terms of strengths, there's two that come to mind. The first one is my research experience in social inclusion. So I got into research quite early in undergrad, and I was always motivated to to research practices that would promote learning and inclusion in community and school settings. So I did come from a comprehensive understanding of what social inclusion is in the research literature. And I felt like that helped me as a basis to facilitating conversations in our stakeholder meetings. I also found that a lot of the research that I'm doing now is strengths oriented. And so I think that that helped me a lot when we were writing up the briefs, because I think in order to communicate to the government, it's important to highlight the things that have been doing well and the positive steps they've been taking, and the next steps. And I think that strength-based writing skills I was able to borrow from my research that focuses on the strengths of autistics and neurodivergent individuals.
Yeah, that's really important to have, especially working with community partners. Over to you, Jill. Especially with your advice over the years, what advice do you have for researchers in general in engaging with stakeholders and community partners? Yeah, you just have to unmute yourself there, Jill.
I'm glad I got to answer this question, Jonathan, because I feel like I've heard from a lot of stakeholders about this question in particular. So I think I have about 4 or 5 that I'd like to share. So some advice. One would be having the community be a part of the data collection right from the start. So what data do we already have? What's available, and how do we share that data amongst researchers and community organizations? So I think that would be one piece of advice. Like, look what's already out there, and look what also the community organizations can have can be sharing already, responsibly, of course, but available to share. I think another one would be for researchers to resource community organizations to reinforce the priorities identified by the community, so that we're asking the meaningful questions, so that it's really driven by the community, driven by that end user of the research. What questions are we interested in? What questions is the community interested in? Make sure those are meaningful questions before we go and we spend the time to do the research. I think there needs to be a better sort of approach or practice or consistency with making a co-design in research. So that's with first person, other stakeholders, really that end user of the research. Make sure that that's a co-design approach right from the start, and make sure that we're making that best practice, like that it's consistent across all levels of research or all sectors of research. Should I say that there needs to be a co-design right from the start? And as a community, we are really pushing for that. Again, another one would be identify how to coordinate with the community organizations and other stakeholders to encourage participation of like that end user of the research, right? How do we make sure that we're encouraging participation? And is some of that about better knowledge mobilization, right? So do we have to make sure that that's a real goal, a real key performance indicator of the research? If we're really making sure that upfront we identify what are those knowledge mobilization activities that we'll do, that we promise that we'll do within our research. And then I think one that I hear often and may not align with all my other ones, but may go a little bit off topic, but really like, how are we over collecting from certain populations, right? How are we making sure that we look at this diversity across Canada and populations that we're not getting involved in research? And for those populations that we're not getting involved in research, or we haven't had, you know, the access to getting involved in research has been limited to those populations, how can we encourage involvement? And so what can community organizations do to reinforce that engagement, but also just as like, you know, as a village, what can we make sure that we're learning from all different populations so that we're not over collecting just from a certain population? So I think that that's what we hear a lot across the board when it comes to participation in research. And those would be my top 5 advice for researchers.
Great, thanks,
I have
Jill. That's
one further thing from what
you hear. Sir, go ahead, Maddie.
Yeah, I have one further thing from what Jill was saying, that engaging with stakeholders shouldn't be a one-time, one-way routine, which has been that way a lot in the past. As you learn things through your research that provoke more questions, or as your findings lead to possible solutions, reaching out to stakeholders for further insight can be helpful in continuing that relationship.
Yeah, definitely. Jen, if you're checking the chat, if there's any other questions that kind of came through from
there. It's a great reminder, and just so everyone knows, please post your questions in the chat. We're monitoring them, and we'll take Q&A kind of after each of the segments. So feel free to post them in there. One question I had for this group here was, you know, given this is the National Autism Strategy, you know, do you have a sense that this has a lot of application beyond just an autism specific lens? You know, do you, I know that this is kind of a government kind of framed initiative with kind of an autism focus, but I wonder if you have comments around kind of the relevance to other neurodevelopmental disabilities in the broader community. I don't know who wants to jump in there. Jill, go ahead.
I think we had a really interesting meeting during our working group, and Jonathan, you asked Maddie earlier, like what worked well. Well, the diversity of our own working group really worked well, because we weren't all autism specific. Like our lens wasn't all autism specific. Some of us were and some of us weren't. And so that really added depth to the way we were thinking about social inclusion. And I think it reinforces for, you know, moving forward around policy and to think about, you know, neurodivergent, but also a whole range of neurodevelopmental disorders, and maybe not just a focus on autism, but important to have autism there too. Right. So we really had a great opportunity in our working group to have expertise from across a broad scope of neurodevelopmental disorders, sort of some first person perspective, some expertise from community organizations. So I think it was really helpful, and I think it was a learning experience for us, and something that we would give back to you and Jonathan, Jennifer, to say, yeah, it's nice to have, you know, that different lens of different neurodevelopmental disorders in working groups.
Does anybody else want to jump in on that?
I think Maddie was going to jump in there. You might be muted, Maddie.
There we go. Sorry about that. Okay, I clicked the wrong thing. One of the things being in social inclusion, we talked a lot about what are the barriers. What are the barriers that we're experiencing? And it's a question that, you know, answering that question for every type of disability is what we need to do. We need to start looking at how can we remove barriers and find the accommodations to allow people to participate on a level playing field. And in our group, we certainly talked a lot more about how other neurodevelopmental disabilities can be, like, the things that we're recommending can apply to that wider lens, that wider group. But I think as the government's going through looking at the National Disability Inclusion Plan, Disability Inclusion Action Plan, it's the same kind of concept. What are the barriers and how can we remove them? This process that we've gone through can certainly help the federal government in that respect look at answering the same questions that we did.
Yeah, those are great points. One of the questions in the chat also got to the question around diagnosis. So how relevant is this work to those who maybe don't have a diagnosis but have autistic tendencies? Do you have any perspective on that?
I have a saying that I try to I use everywhere I go, and this is what I would really love us to really focus on, is that we need to support the needs and not the labels. So the labels are an important thing right now because they are the ability for us to support needs. We need to move away from that in general. Inclusion happens where needs are recognized and accommodations are made. So that's the goal I think that we should have in the future, and how we get there is what we really need to figure out.
Yeah, thanks. And it's hard in policy. We try to move things forward one piece at a time. And right now, the priorities of the government allow us to leverage the National Autism Strategy to benefit a lot of other pieces, as Maddie, you brought up. And none of these policies are mutually exclusive. The government will use it in different parts, and it's good to, as Jill mentioned, to get all those voices in there. Hadassah, you mentioned the values of people coming together. I think that's going to be important, and the skill sets of various stakeholders. The diversity of that really creates a rich experience for all those who are involved. Any final words from this panel before we moved on to the next set of speakers?
Okay. I have one final thing, Jonathan, if I could. I just think having the fellows gain the experience with working with communities and stakeholders is amazing. So these young people being able to have the experience of working with the community and other stakeholders, it just means that we're moving that co-design approach to the next experience or action that they undertake. So I'm just really proud of us for bringing that together. So thanks.
Thanks, Jill. Over to you, Jen, for introducing the next session.
That's awesome. Thank you. Thanks to everyone on that great session. And I couldn't agree more, Jill. We're really excited to bring you the next 3 policy fellows who worked on the evidence-based interventions piece. So we're going to hear first from Jessie Lewis, who's a MSc, or who has an MSc and is a doctoral student in the clinical neuropsychology program at the University of Victoria under the supervision of Dr. Sarah McCune. She's interested in how policy development affects accessibility of resources, supports, and services for children with neurodevelopmental disability. And she's presented research exploring the efficacy of current funding and service allocation models. So as a CASDA KBHN policy fellow, she hopes to build on these experiences and learn more about policy development and how to best meet the needs for those it's intended to serve. Next up, we're going to hear from Jessica Baraskowicz, who is a PhD candidate in the School and Applied Psychology program at the University of Calgary under the supervision of Dr. Carly McMorris. Her research is focused on mental health in autistic youth, and her dissertation project has looked at body image and eating concerns in teens with and without autism. She has extensive clinical expertise working with autistic children and youth and helping them address various needs. And through her interactions with individuals and families in a research setting, she's begun to understand that complexities and challenges of accessing services, and this fellowship is expanding on that. And then finally, we're going to hear from Vanessa Fong, who's a doctoral student supervised by Dr. Grace Arocchini in the Developmental Psychology program at Simon Fraser University. Her thesis adopts a community-engaged approach to understanding quality of life and service navigation in culturally diverse families, raising autistic children. She's previously been supported by MyTax KBHN Internship Award, and that's a plug for all those who are interested in those. We're running them again and encourage you to apply to them. And during this internship, her research focused on exploring the impact of COVID-19 on mental health and service needs of caregivers and families of individuals with developmental disabilities. And so this policy internship has helped her expand her knowledge area. So I'm going to hand it off to Jessie to take it away.
Hi, thanks for that introduction, and thank you to everybody who's here. Our group is looking at how policy can be leveraged to provide autistic individuals with equitable, high-quality supports that are tailored to their needs. So we each kind of took a separate piece of this, and I came into this process really interested in what types of supports were available to whom and how these services were provided. So through background research and discussion with our working group, it became very apparent that this varied greatly both across the country as well as across the lifespan. So levels of funding, provision of services within the home versus school versus clinical or community settings, and then the ranges of supports available just varied by both region and age so greatly that some had access to what they needed while others had no support at all. So in terms of regional availability, that could often lead to uprooting of lives in order to move to an area with better supports. Though that's not possible for all, nor should it be necessary. And then with regard to age, many of those policy gaps occurred at critical points of transition, such as adolescence and emerging adulthood. And generally, there's a steady decrease in available support as individuals get older and move beyond youth. And that leads to decreased utilization of services, either out of lack of availability or affordability. So for instance, diagnostic assessments for adults can be nearly impossible to access, and then services or supports beyond diagnosis are similarly few and far between. But that decrease in support doesn't coincide with a decrease in needs. So current policy is just not adequately providing for autistic Canadians across the lifespan as well as across the country. So in our discussions, our working group first identified the need to create equity in funding and resource allocation, like I said, across the lifespan and country. So support should be needs-based. We heard Maddie speak about this just before. Support should really not be tied necessarily to labels, but to what is needed. And then both diagnoses and funding should be transferable across provinces and territories. Given the current disparity in available services, there really needs to be an emphasis on increasing funding and supports for autistic adults and underserved populations. So our first kind of recommendation is around the creation of that equity and how that needs to be a focus moving forward. So a recommendation to both the federal government as well as provincial and territorial governments. And then further, all autistic Canadians deserve high quality support. So we should establish national standards of care that all service providers are required to meet. There was such variance across the country. It would be really great for the federal government to establish these standards of care and mandate that the provinces and territories meet these standards. They should be broad ranging and cover such supports as respite care, as well as services such as gold standard diagnosis, mental health, speech, social skills groups, occupational therapy, etc. So really whatever is needed by the individual. And they should also address factors such as how long individuals are having to wait, time to diagnosis, things like that, that really impact the efficacy of the care that's being provided. And then in order to track how well those standards of care are being met and the state of supports for autistic Canadians, a national database should be created and maintained with mandated participation across the country. And that could provide information on demographics, state of care by region, wait times, types of services available, who's receiving the diagnoses, what languages are being spoken, everything like that. And then it could also look at short and long-term outcomes for those engaging in services, which could help us really better understand what is useful for autistic individuals across the spectrum. And then from that database, further informational resources could be created to help autistic individuals and their families navigate and access services. So another thing we really heard was just there's so much out there information-wise, but it's not really easy to get to, or it can be sometimes hard to navigate what services to access and what might be helpful and where do I go to get those. So by compiling all of this information in one place, we could really create some useful resources that then could be patient-facing or client-facing and also provide some help and guidance. So overall, just really looking at making sure the standards or making sure the care that's provided is meeting the needs of the individuals it's intending to, and that this care is consistently high quality, no matter where you are, no matter what age you are, so that we can really meet the needs of everybody. And with that, I'm going to pass it over to Jessica.
Awesome. Thanks, Jessie. All right, so the piece that I've been looking at is access to mental health services. And as part of my PhD, I've been involved in providing treatment for mental health issues to autistic youth and their families in various settings. So coming into this fellowship, I had some familiarity with kind of the clinical side of mental health services. And in my clinical and research work, a common thread that came up with families is how difficult it had been for them to finally access services because of the siloed services or the lack of professionals who provide mental health services, or the excessively long wait times for those who do provide mental health services. And of course, we know that the research supports those anecdotes as well. We know that mental health services represent one of the top unmet healthcare needs for autistic individuals across the lifespan, yet it's an area that continues to be largely neglected in policy. We also know that provincial and territorial policies and entry points to services are inconsistent, and there are significant barriers to accessing and participating in services. So altogether, these issues result in autistic Canadians not currently having access or having equitable access to mental health services. And that gives a bit of the background information on kind of the state of mental health services for autistic individuals across the country. And in our working group, one of the key questions that we posed was, what might it look like to have adequate mental health services accessible to all autistic Canadians? And this question sparked a lot of conversation around things like having metrics to measure services and access to services, having things like a maximum amount of time that people would have to wait, especially for crisis supports, having more education and training for professionals who work with autistic individuals, more availability of affordable services, and also making the services more easily accessible, and especially less kind of splintering between the different services. And then alongside some of those discussions, we also had broader conversations about things like how many healthcare providers are misinformed about autism and mental health, how mental health struggles are sometimes caused by a lack of services and understanding, or can definitely be impacted by those kinds of things, as well as consideration of what the end goals of evidence-informed supports and services are more generally. And because mental health services are delivered at the provincial or territorial level, we had a lot of discussion around how to make recommendations that are actionable at the federal level and avoid some of the jurisdictional issues. So in its current state, what we've developed so far are two kind of key recommendations to address mental health services, with some specific ideas to make those recommendations actionable. So our first recommendation is to increase the number of mental health professionals who can treat mental health issues in autistic individuals. And some of the mechanisms to help achieve this that we've provided are working with national professional organizations, such as the Canadian Psychological Association, for example, to do things like allow cross-provincial or territorial practice, and importantly, providing funds to facilitate conversations between provinces and territories to make that recommendation actionable, as well as providing funds to incentivize professional bodies to offer continuing education opportunities that are related to mental health and autism for professionals that are currently practicing, as well as providing researchers with specified funds to publish their research that has the potential to improve mental health care for autistic individuals, to publish that in open access journals to make those findings more accessible to working professionals. And then expanding on one of CASDA's previous recommendations around creating a comprehensive training program for professionals, making sure that any sort of program like that would include a focus on providing mental health supports to autistic individuals across the lifespan. And then our second recommendation is to encourage provinces and territories to review and modify the provision of mental health services for autistic and neurodivergent individuals, essentially encouraging them to remove the silos between the different sectors where people might access services. And one of the key mechanisms that we've proposed to address the issue of kind of service splintering is for the federal government to provide some leadership and collaborate with provincial and territorial governments to develop national standards of service delivery that prevent service providers from, for example, disqualifying an individual from receiving services based on their autism diagnosis. And in doing that, linking to one of Jesse's earlier recommendations around providing tools and supports for navigating between systems as well. So overall, kind of making mental health services more accessible through providing or having more providers who can provide those services, as well as some of the systemic things that prevent people from accessing services. And with that, I'll pass it over to Vanessa, who will talk about her part of our policy brief.
Thanks, Jessica. So the sub-theme that I was interested in focused on underserved communities. So this interest stemmed from the work that I did for my dissertation, where I partnered with a Korean nonprofit that supports mostly immigrant families of children with developmental disabilities, to understand their perceptions of service delivery in Canada. So one thing that I found in my own research was that for Korean families, like many other immigrant racialized communities, they're often not considered when it comes to service design and implementation. They're often under-researched and underrepresented in important policy making decisions. And as a result, this contributes to health and service inequities. So I thought that this was really important, especially around the topic of evidence-informed services and supports, where access to these is a strong predictor of long-term outcomes, that it was important to apply an equity lens to this work. Being aware of individuals or groups that were not present and making efforts to reach out and engage them. So we tried to be very inclusive in our group, identifying those people that were missing and doing as much as we could to adapt our meetings to be flexible and reduce barriers to participation. And sometimes this meant holding the same meetings in different time zones or meeting with parents individually at a time that was convenient for them. So we had one parent, for example, who lives on a reserve in a remote area, has a very busy schedule because she spends a substantial amount of time commuting to her child's therapy. So we decided to meet outside of our regular meetings. So in our working group, we had some very thoughtful discussions about equity. There's sometimes an assumption that by improving policies or programs for members that belong to the majority, that it will automatically benefit everyone. But the reality is that it's much more complex. And while there are certainly barriers that are encountered by most people, there are also unique barriers that are specific to underserved communities. So in our group, we really wanted to center these voices. So as a group, we were able to come up with a list of barriers specific to underserved populations. We then identified potential solutions to try to address these. So one of the most significant barriers to accessing evidence-informed services and supports related to just the overall lack of supports in remote and rural areas. So we tried to think of examples in other fields that have reached success in attracting healthcare professionals to these areas. And one example that our group came up with was using a similar model to medical schools in Canada that partner with northern communities to provide incentives such as scholarships, bursaries, loan forgiveness programs in exchange for providing services in these areas. Another significant barrier that was identified by our group related to service navigation challenges, especially for newcomers, immigrants, and ESL individuals. So one recommendation to the federal government to address this was to create federal grants and partnerships to support cultural community organizations that specifically serve these communities where they can provide targeted support. So things like translation services, interpreters, and service navigation support. Another barrier identified by our group related to the lack of awareness of developmental disabilities in some cultural communities, especially where there is a lot of stigma. So to address this, our group also recommended that the government needs to work with these community organizations in setting up cultural outreach initiatives and co-creating culturally appropriate services and supports with Indigenous leaders and organizations. So I don't want to take up too much time, but these were just some of the key findings from our group discussions on this topic. So with that, I think we'll go back to the discussion and Q&A portion. Thank you.
Wow, wonderful. Thank you so much, you guys. That was a great overview, and just really scratched the surface of the important consultation work that you've been doing. I'm going to now introduce the CASDA board member that's been a part of this process, the wonderful Kim Ward, who's has a PhD in clinical psychology and is executive director for the Society for Treatment of Autism. The Society of Treatment of Autism provides an array of services to enhance lives across the spectrum, including early intervention, out-of-home placements for complex youth, community consultation, life skills, and employment supports for adolescents and adults. And she's also worked with the government of Alberta to develop a resource manual for teachers and draft recommendations for service delivery. So a real asset to have as a part of this working group. And she's also a board member with CASDA. And so thank you for joining us as well, Kim. And I was going to put the first question to you, specifically around what worked well in this process and what did you learn from this experience?
I think what worked well, evidence-informed supports is such a broad topic, and stakeholders have very passionate opinions. So I think one thing that served us well is that the fellows all had identified sub-themes going into our stakeholder engagement, because I think it would have been difficult with that really broad group to come to consensus on specific themes. And Vanessa touched on this as well. I think it was really important for us to have multiple meetings and to reach out to people in different ways. I think that worked well for us. Not realizing our first doodle poll, we had set up our meetings for the group and then realized that actually the times we had set were a barrier to participation for people who worked and weren't able to participate during the day, who lived on the West Coast. in terms of what I learned, I guess there's two things. From a process perspective, I would say one thing I learned was that it's really important to be very clear about terms of reference and what's in scope and what's out of scope. Again, coming back to the fact that evidence-informed support's a big topic and passionate opinions, and making sure that people knew what the group was going to be about and what it wasn't going to focus on. So making it really clear what's in scope, what's out of scope, just so that everybody who participates, you want them to go away feeling like that they were heard and feeling like that the group was of benefit to them. On the clinical side, I would say one thing that I learned was just about the importance of respite. I can't tell you how many times the topic of respite came up, whether it was talking about mental health supports, talking about underserved populations, talking about ages and settings. Respite came up, and what really resonated for me is the fact that with respite, some other services may not be, if there were adequate respite, other services may not be necessary. And the last thing that I think I learned, and I'll echo what Maddie said earlier, is just the need to look beyond kind of autistic-centric solutions, that what's beneficial for ASD is likely to be beneficial for the disability space in general, or it might even be beneficial for society as a whole, and that we don't just need to think about what's going to serve this population, that if we think about broader solutions, those are going to be more beneficial in general.
Yeah, those are such great points. And I mean, it's such a important thing to remember from a policy perspective, because, just because this has an autism lens on it doesn't mean that it's just for, it's mostly, can be very relevant to a much wider community. And I totally agree that the policy impact goes beyond neurodevelopmental disability communities and to the general public as well. I guess the next question I'd have is for our policy fellows, Jessica, Jesse, and Vanessa. You touched on your research backgrounds and kind of how that interplayed with your policy work that you were doing. But what has helped you and your stakeholders and partnership experience during this internship? And most specifically, what advice do you have for other researchers and trainees who maybe are interested in engaging in this space a little bit more now that you have this experience? I don't know who wants to start. Maybe does anyone want to jump in there?
Sure. So obviously having this fellowship opportunity was a huge way to kind of get involved for the first time. And I learned so much. I would recommend this sort of opportunity to anybody. But I also think that it kind of opened my eyes to that you can get involved in like these working groups and these calls to action that go out. Like, you don't have to be the leader of the policy initiative. There's so many different ones going on that you can take part in, and you can really learn the process that way as well. I know that's one thing I'm excited to kind of keep an eye out for and stay involved with, is different calls to action that might come out.
That's awesome. Vanessa, Jessica, anything to add?
Yeah, I'll go. So similar to what Jesse was saying, I also found that it was really helpful being around a very supportive team. Jen, Jonathan, Kim, and my co-chairs, having regular meetings and making sure kind of everyone was on the same page really helped. This is a very new experience for myself and probably most of the interns. So just kind of learning that it's okay to ask questions and to not know exactly what you're doing all the time. It's quite unfamiliar territory for most of us, but it was such a wonderful learning experience.
Yeah,
that's great.
And I echo what Jesse and Vanessa said. And I would add that, as researchers, sometimes we have the tendency to come at things very systematically, and you do a lot of reading and you hope that you understand something after reading it. But oftentimes our community partners, families, the people that we're working with, they know a lot more about policy than we can know from reading about it, because they're living it, right? They're actively navigating the systems and policies that are currently in place. So of course, as researchers, doing your background reading and learning all of the things you can that way, but really giving attention and space to, okay, this is what it says on paper, but this is what I'm hearing it actually is like in real life, is really invaluable.
That's great. And I guess the other question I'd have for Kim is around sort of on the flip side, any advice that you'd have for researchers in engaging with stakeholders and community partners?
I think creating authentic and genuine opportunities. I mean, I think people want to be heard, and creating a space where they feel that their opinion, you know, that they had the time and the space to share their opinion. I think for our group in particular, you know, one of the things we did was task those that attended the meeting to think of what voices were missing, and actually asked if they could reach out to their networks, because I think there's a lot of power in that we may not have had all of the voices at the first meeting, but by the end, I think we had reached out to the voices that, you know, showed up on our Jamboard. Initially, we had said, who's missing? And I think by our sixth meeting, I think we had 6 meetings, I think by the end, we had sort of tapped in and felt like, you know, we had reached out to the people that, you know, should be there. You run the risk of having different people at different meetings, but I think actually that stimulated some discussion, because there were people who hadn't had a chance to sort of bounce ideas off each other. So as much as, you know, sometimes you talk about having cohesiveness in a group so that people are comfortable sharing opinions, I think in our case, having diversity might have stimulated more discussion.
Yeah, no, that makes a lot of sense. One of the questions in the chat is around why, I guess this would be more for Vanessa, why racialized communities are underrepresented in research. Do you have any perspectives on that, Vanessa?
Yeah, I think it's the big question. I think that a part of it has to do with just our recruitment methods that we're used to using just doesn't always work. Putting out a general call for people doesn't necessarily work for these, you know, these underserved communities. You kind of need to be flexible in your approach and use different strategies. We had a lot of help from other members in our working group kind of tell us where to go and guide us, and that was really helpful. We had some people recommend which organizations to reach out to. So just meeting with these or contacting these organizations or individuals very individually, meeting with them and telling them kind of like what the purpose of this group is, what they can get out of it. You need to do a little bit more kind of, I think. Yeah, does anyone else want to add to that?
I think that was a great perspective. Are there any final comments from this group? This was a really great discussion. Any final comments you want to make before we wrap and shift to our third segment here?
Maybe just thanking those who did participate in our working group, because we had really, really great discussions, and you know, people gave a lot of their time and a lot of their opinions and experiences, and it was invaluable to learn from them. Like it was incredible to, kind of just be guided through the process and get to hear stakeholders and interact with them firsthand, and get their words down on paper to turn into policy.
That's fantastic. Thanks, Jessie. So thank you, everyone. Those were great presentations and discussion. I'm going to hand back to John to introduce our final 2 policy fellows.
Thanks, Jen. Yeah, that was very powerful, you know, hearing about the voices that they're trying to bring to the table. And at CASDA, a lot of the work we're doing is leading by convening. How do we bring people in? And, you know, this partnership that we've had in bringing trainees and voices that are usually not there to inform policy and be involved in the process, even though it may be some person's first time. That's really important and something we want to always shift the power dynamic in such complex systems. So last but not least, our final working group on economic inclusion. This was the 3rd group, the 3rd frame which the government gave us for the National Autism Strategy. So I'm going to call up Wasan Nagib and John Sheehan to the screen. Just a bit of a background about Wasan and John. Wasan began after several years of professional practice as an architect and community planner. She went back to graduate school at McMaster University. Their interests included creating enabling environments for individuals with disabilities and developing evidence-based policies to improve their inclusion in employment, housing, and the broader community. Their dissertation was funded by a SSHRC fellowship entitled Surviving the Labor Market, Understanding the Experiences of Women and Men with Autism. The study focused on exploring the role of gender concerning factors around career decisions, barriers to finding jobs, and workplace challenges to maintain employment. Their work contributed to with several policy implications, including gender-sensitive programs and support services to improve women's employment experiences and work-life balance with autism. John is a PhD candidate in clinical neuropsychology at the University of Victoria, where he specializes in early assessment and diagnosis of neurodevelopmental concerns and the development and evaluation of accessible and affordable clinical interventions. As part of his work to create and improve early assessment tools, John is the co-creator of a computerized preschool executive function battery, a group of tablet-based assessment tools that evaluate executive function abilities of preschool children. And in his work, his primary interest is in the role that various systems play together in the emergence of neurodevelopmental concerns and how they can be optimized to help children and families find and reach their unique goals. So over to Wasan and then John for the presentations about economic inclusion.
Thank you, John. So economic inclusion focuses on the ways to remove barriers and promote fair and full access across the main sectors that affect the economic well-being of people on the spectrum and their families, including employment, housing, transportation, and taxation. Prior to consultation meetings, our work aimed to leverage and advance the conclusion of the extensive work done by CASDA KBHN Policy Working Group in fall 2020, which was materialized by writing the policy compendium. The compendium identified 6 policy briefs and a combination of tangible policy solutions related to the 3 main themes of economic independence: employment, housing, and taxation. We, the Economic Inclusion Work Group, aimed at investigating any missing issues, policy directions, or solutions. We have conducted an extensive review of both gray and academic literature. Gray literature was particularly important to provide a broader overview of issues and policy recommendations. We followed the gray literature search plan suggested by Godin et al., which incorporates different searching strategies, including gray literature databases, customized Google search engines, targeted websites. The results identified important local and international sources of information, including online blogs and forums, which can be considered as natural voices representing a proxy for everyday discourses within the online autism community, provincial and federal policy documents, as well as international autism strategy documents. We have analyzed these resources and identified issues and potential policy solutions to be verified through the following stakeholder engagement sessions. The findings identified transportation as a major issue that was missing from last year's review. According to recent research, the challenges with obtaining a driving license or navigating transportation systems make up to 80% of autistics rely on family and friends to meet their transportation needs. This negatively impacts employment and the opportunity to benefit from social services and programs. The initial stakeholder consultation identified 4 key policy recommendations that federal governments should do. The first is to coordinate with providers and local governments to ensure consultation with autistic individuals and their families with regard to any municipal transit activities. The second is to ensure adequate funding for safe and reliable transportation through programs to increase public awareness, enhance service level, and provide training. The third is to introduce regulations to ensure transportation providers' commitments to inclusions. And finally, to support further research about enhancing transportation skills and independence. And now I will hand it to my colleague, John, to talk about his part.
Thank you, Wasan. So as John mentioned, one of the primary interests that I came into this experience with has to do with the way in which different systems interact to create disparate outcomes. So this goes down to, obviously within neuropsychology, we're interested in neurological systems. So, how does the way in which, autistic or other neurodiverse populations, process the world differently than perhaps other groups, and how does this play out in the real world in the way that they interact and would, preference different ways of having output or engaging with employment settings. And it goes, into broader systems such as, family systems, employment systems, and then provincial or local community or national systems as well. And so that gave me a lens in terms of the needs that were, we needed to bring into this economic inclusion group in terms of stakeholder mapping. And so, as we went through some of the, areas that Wasan was talking about, we started to, try to parse out some of these different different areas within the stakeholder groups that we needed to identify in terms of our recommendations. So as we considered these different areas, they really came down to, 4 kind of key, considerations that need to be identified. The 4 had to do with 1, geographic, differences. So talking about differences between policies and supports that are available across provinces, as well as those that are, functionally available to urban versus rural settings. Another one has to do with industry-specific considerations. So there are differences between the employment experiences, for example, or the transportation experiences with people in different industry sectors. And so we had to consider that as well. The third had to do with socioeconomic factors. And so, we have to, understand that even within the broader autism community, there are, socioeconomic differences that have to do, for one, primarily with taxation, but those socioeconomic factors also play into ways in which transportation is accessible, or the type of employment or the opportunities that exist for people within different socioeconomic groups. And then the fourth and perhaps the most important have to do with individual difference factors. And so, this could be something like the age and stage at which, an individual finds themselves engaging in these different areas. Same with, different types of cognitive differences, such as verbal and nonverbal, things like that. And so I think that one of the things that really was important for Wasan and I. Both of us have, kind of an applied or real world experience, children that are within this, kind of the big umbrella of neurodiverse differences. And so we brought kind of a real world applied understanding to this and wanted to make sure that we were able to capture that so that our recommendations within economic inclusion could be something that the federal government would understand that they need to, essentially zoom in and zoom out of these different factors. And I think that this can be, explained within an example of like employment. So within the employment, area, there are, very specific factors that, essentially bring to bear, different challenges that somebody would face. So, autistic individuals, have some universal, challenges that they might find in the employer-employee relationship. But, across the geographic, industry, socioeconomic, or individual difference areas, there are also individual challenges that they might face. And so the stakeholder mapping exercise, is one where we're trying to help the federal government understand all of these different lenses that they need to look at the same problem through in a number of different ways to ensure that they're able to capture, all of the challenges that exist so that the recommendations can be, specifically tailored to not just a broad community, but to an individual person. So we don't want that individual to be lost, in all of the recommendations. And, in terms of the way in which we went about this, there are, the feedback that you can get from these group collaboration type of experiences, but we also are still in the process of utilizing a survey because we understand that a lot of different people within the autism community aren't able to participate or prefer to offer feedback in a diverse number of ways. And so we wanted to capture both the depth and the breadth of the experiences that people have within this very large umbrella. Economic inclusion, one of the big challenges for me was understanding all of these 4 different areas, even though we are kind of honing in on transportation, for example, as one policy area where there was not a brief that was previously offered last year. We also wanted to make sure that we were, capturing all of these, areas that had not been thoroughly addressed and in prior briefs across the other 4 areas. And so this means of feedback through survey, for example, is one way that we can get more feedback from a broader, community within the autism community, so that we can make sure that our recommendations are able to be applied to a diversity of individuals within the autistic community as well as the broader lens. So I'm going to turn that back over to John and Jen so that we can have a broader Q&A.
Thanks, John. It's really interesting to hear about how you guys are framing the stakeholder mapping, and with the geography, thinking about industry-specific pieces, the socio-economic and individual. I guess let's start with that. And first to you, John. What's kind of surprised you as you kind of went through that stakeholder mapping, and even the way it was framed, or how that kind of came together? Anything about the process or even the content that kind of jumped out at you?
Yeah. So I think that for myself. I come from a child lens, so I'm consistently within my own area of research and clinical practice, focused mostly on child and family settings. And I think that some of the learning experience for me has been coming to understand kind of where Wasan's area of expertise is more in the adult or applied sector, helping to understand what it's like for an individual adult with autism who is trying to navigate all of these systems, and how overwhelming it can be to try to figure out, how do I, as somebody living in British Columbia or in Ontario or, different areas, how do I, navigate through these services? And I find that a lot of people aren't aware of all of the different, resources or supports that are available. And so just helping to educate myself in terms of, not just what's available, but what are people aware that's available, and how do we, identify, gaps in communication between the federal government, the provincial and local community, and the individual who has, real applied specific needs. If there are resources or not, if they're unaware of those resources, then it doesn't matter that they're available. And so we need to make sure that, we're not just addressing, what are the supports that you're going to offer, but also how are you going to make sure that these supports reach that individual who's looking for those?
Mm-hmm. Thanks, John. Wasan, over to you. So John did mention that the survey was still live. Do you want to talk about the process of putting that together, and maybe if it's still live, how can stakeholders still get involved if that's still the case?
Yeah, so the survey is still out, and we're still getting responses. So as John mentioned, we wanted to get diverse responses and make sure that we're catching different perspectives. And the purpose of this survey in particular is to ask participants about key issues that have not been addressed before, and potential policy solutions specific to economic inclusion. We looked at critical insights and perspectives related to primary policy areas, and what else? And we have listed, of course, we started by listing the key issues in the policy that was mentioned by CASDA. And we wanted to give the participants an opportunity to recommend additional practical actions, and also the opportunity to inform us of any additional issues related to the areas of employment, housing, and transportation that has not been addressed before. Yeah.
Thanks, Wasan. And I'll go with you first, and then I'll go to John. For both of you, I guess, more about the process of being involved in this work. What advice do you have for other trainees or other researchers who might want to be involved in policy work in this same sort of way? Any advice to give them?
Yes, so I found the CASDA KBHN internship to be a very valuable opportunity to engage in practical, real-world and large-scale policy-making process, and an opportunity to learn from subject matter experts in the field. The CASDA and KBHN expertise and supervision with the wealth of available documentation on the websites made the internship a great experience and very informative and enjoyable. And I believe that for a successful stakeholder engagement process, the research should plan for the process as early as possible, and we need to make sure to engage a broad spectrum, yet manageable number of stakeholders, and to clearly articulate the objectives and list of questions or issues to be covered, draft and distribute an agenda before sending invitations, and finally, to mindfully envision the meetings and how the discussion could proceed.
Thanks. Well, John, any other pieces to add?
Yeah, I think that one of the problems that we have sometimes, particularly within academia or the kind of broader research, is that kind of old notion of the ivory tower, where there's the researchers establishing the question and then going to the community and saying, okay, how do we solve this problem, or how do we address this issue? And I think in order to break down that kind of that barrier between the academia and the community, we need the community involved at the initial stages of development. So there needs to be a more applied focus on what are the areas that the community is has questions or needs or things like that in, and how do we formulate our research around that. So the community should be involved in the formulation of those questions, and then identifying okay, now who and how in the community are we going to go about engaging with and helping to formulate a research method to be able to answer and address those questions. And so it's really about a collaborative process from the outset of the research, rather than having the community come into involvement later on in the process. I think that that kind of that equilibrium between community and academia, rather than a top-down, really helps to drive applied and helpful research more so than the way maybe it's traditionally been done.
Yeah, thanks, John. It's interesting, like in this kind of moment in history in Canada for National Autism Strategy, we do have this sort of nexus of researchers working with community, and we have some policy receptors. That's something new that hasn't been there, and we're seeing with the Disability Inclusion Action Plan. Maddie spoke about it earlier. We're seeing a sort of a broader approach and a way of thinking about disability that we're working to inform and guide together. Any other thoughts from either of you two, or Jen, if there's anything else in the chat, feel free to jump in as well.
I think you've touched on a lot of the questions that came up in the chat. I mean, one of the comments, and maybe the two of you want to reflect on that a little bit, is just around, that tension that exists around, this is the National Autism Strategy, and kind of how to, apply that lens more broadly to neurodevelopmental disabilities, and recognizing, the government is kind of rolling out the National Autism Strategy, and you kind of are you're given this task and trying to adapt. But I guess your reflections on the engagement process and what that meant for stakeholders in the broader neurodevelopmental disability community. Do you have comments on that?
Yeah, so I can speak to that at least first. So I think one of the things that came up is it's not just about autism specific factors. It's about basically a flexibility on the part of the community and the systems that autistic people and the broader neurodiversity community are engaging with. There's historically been really the onus has been put on the individual to be able to adapt and change to systems that are not necessarily designed for them. And some of the things that have come up is ways in which we can design, for example, employer and employee relationships and dynamics where it's mutually flexible interaction that can be mutually beneficial. And so it's about recognizing that sometimes the system that individuals are existing within are creating problems or creating areas where something might be an apparent deficit where it doesn't have to be. It can be something where if there's a little bit of mutual flexibility, supports that are offered up, then people across the neurodiverse spectrum can not just survive but thrive and be able to offer employers, communities, and et cetera, opportunities and advantages that they likely didn't even know existed before. And so this is, a great time in history for, people to understand that inclusion doesn't mean, accommodating for something that is less than, but it's about having a flexible understanding of, what it means to have an inclusive community and an environment where individuals from all different kinds of backgrounds and people with different types of strengths and weaknesses can thrive and create opportunities that are new and exciting.
Yeah, no, that makes a lot of sense. That's a great perspective. Wasanda, is there anything you wanted to add before we wrap up?
Yeah, I wanted to add on what just John mentioned regarding the inclusive recruitment practices. I would say that jobs should be designed to maximize potentials for not only the autistic individuals. For example, the typical unstructured first date style interview should be changed. It is not only discriminating for the ASD community, but also members of the neurotypicals even, they were saying that it's insufficient as a recruitment tool in general. So I believe that the implementation of this will be beneficial for the whole society.
Yeah, no, that's such a great perspective to finish on, I think, because I think that really is the reason, or what we need to be sharing more broadly in kind of federal and provincial governments, is understanding that inclusive disability policy is really just good public policy, full stop, across all ministries, and so kind of infusing that more broadly is better for everybody in society. So that's a great perspective. We are unfortunately at the end of our time. I think it's flown by. I know I've been immersed in the discussion, and first of all, just so thankful to all the speakers here today. You did a fabulous job in this virtual environment, and I think it's really exciting to see how much you've grown and really dove into engaging in sort of this policy development process. And it is an exciting time when there are some initiatives underway, as John mentioned. So next steps for this process are to really develop the policy briefs that you've heard about. So they are going to be coming out. They're kind of in the drafting phase right now. So stay tuned, and they'll be, of course, posted through the CASDA and KBHN websites, but also shared with government. And that's a really important piece. We also invite your perspectives. So if you've heard something here that you want to share back with the policy fellows or with us, feel free to get in touch. That's really welcomed. Yeah, just really excited about the next steps for this process, and really proud of all the work that the policy fellows have done here, and thankful to the CASDA board members for the enormous amount of time and energy and really thoughtful advice they've provided and guidance. John, is there anything you wanted to say to wrap up?
I think you covered it all. Thank you, everyone, for joining us. Thank you for the fellows the co-chairs, the CASDA board members, and it's been fantastic working with so many diverse stakeholders over these 2 years, and especially this year, some of the richness of conversation. It's been great to see what's going on in our community. Future is bright. Thanks.
Awesome. So we're going to hand it back to Jody.